Hello guys, once again to my channel. Today we'll be discussing regarding the classification of bone. This is a very important topic because before going into some complex topics, first it is very important to learn the basics of it. So here we'll be dealing regarding the bones, how the bones are classified in the overall body. Since there are many bones in our body, whether you consider as a head region, you consider as the upper limb or the lower limb, there are many such bones. So let's start. We'll be dealing to see what is present in this on our body. So as you can see in the first diagram, it is clearly shown it is a thigh. Thigh region has a bone called a femur bone. This is the posterior rib back of, therefore this bone is called a scapula. Here you can see the cervical vertebrae. Here you can see the radius. Here is the ribs, and this is the bone of a head region. Now it is classified based on the shape of the bone. First is the long bone. Second is the short bone. Third is the flat bone. Fourth is the irregular bone. Fifth is pneumatic bone. Sixth is Sysmoid bone, and seven is the SV bone. Let's long bone. As the word says, the bone is a long bone. It is an elongated shaft. It is now telling regarding the characteristics. What is the compound or the properties of a long bone? First, it has elongated shaft. It has two expanded ends. As you can see, this is the ends, and this is the major region is the shaft region. Therefore, this is called as a diaphysis, and the ends are called as epiphysis. Now, shaft has three surfaces, three borders, and a central medullary cavity, and a nutrient foramen away from the growing end. Three surfaces based on the direction which you are talking. Either it may be the anterior, posterior, lateral, or medial. Borders also same: anterior, posterior, medial, or lateral borders. Central medullary cavity. Since there is a cavity present in the bone, as everyone knows, we have a bone marrow present in our bone. So there is very important medullary cavity should be present. And a nutrient foramen. The word only says that nutrient foramen is present because to supply the nutrients to the bones. Now there are certain examples in this bone. Always remember when you are considering the classification, you always have to read some examples of it. Now it is classified into three types further: typical long bones, short long bones, and a modified long bone. Typical long bones, as you can see, the humerus, radius, ulna, femur, tibia, and fibula. As you can see here, humerus, radius, and ulna are the bones of the upper limb. Similarly, when you consider the lower limb, femur, tibia, fibula, with a secondary epiphysis. What is epiphysis? Epiphysis are the ends. These ends are called as epiphysis. As you can see, these ends are called as epiphysis, and the central region is called as shaft. Second is the short bone. Short bone. The word only says short bone. Shape is usually cuboid or the scaphoid. Scaphoid means the boat shape. It is a boat shaped bone. These are pierced within the blood vessels. As example, tarsals and the carpal bones. As you can see here in this diagram, this is the carpal bone over here. As you can see here clearly, this is the carpal bone. These are the tarsals usually you find in the leg region in the lower limb, and the carpals you usually found in the upper limb. So it is very easy to learn the examples when you consider as a group. Now short bones are considered both in upper limb and lower limb, which have a cuboid in shape, and a scaphoid. Scaphoid means the boat shape, which usually pierced within the blood vessels. There are two examples, major examples. There may be many other examples, but I'll consider this as a major example: tarsals and the carpals. Third is the flat bones. The word only says the bones are flat in structure. As you can see, this is a scapula. It is a flat in structure. This is a sternum. This is also flat bone in our body, and the ribs. Ribs are also flat bones in our body. Now it resembles the shallow plates. It forms the boundary of the body cavity. Whenever there is a body cavity in a body, so it covers it. It forms a covering of the body cavity. Therefore, it's called the flat bone. Now certain examples are there that where it is found. It is found in the bones in the skull region. It is found in the sternum. It is found in the ribs and the scapula. You can see the sternum is the flat bones. This is the scapula, and these are the ribs. Understood? Yeah. Let's move to next. This is the irregular bones. Irregular. The word only irregular. It says the bones are irregular in structure. As you can see, the irregular in shape. See the structure given in the first diagram. So it's such a irregular shape. There is no proper alignment of this. As we saw in the flat bone, there is a flat structure running through it. But here you can see there are irregular components which you can present over here. As also you can see the irregular components are present. Here also irregular components. Therefore, these bones are called irregular bones. Example: hip bones. Bones in the base of the skull. Bones in the base of the skull, I mean sphenoid, and the first and second cervical vertebrae. So there you already remember what are the example irregular bones. First is the hip bones, bones in the base of the skull, which is that bone sphenoid, and the first and second cervical vertebrae. This bone we saw in the first slide, the cervical vertebrae. So these bones are irregular in shape structure. Let's move to next, that is pneumatic bones. The word pneumatic means that it contains certain irregular bones which contain certain large air spaces which is lined by certain epithelium. So pneumatic, what does the word pneumatic means? The word pneumatic says that if a bone contains a large air space which is filled with the which is lined by the epithelium, so that is called as a pneumatic bone. As you can see, such a cavity is present over. See the cavity. So this cavity are present with the filled with the air spaces. So these bones are called as pneumatic bones. Why the air should be present? Let's learn the reason. Why? Because they should make the skull lightweight. As you can see, the skull is filled mostly with the pneumatic bones to make the skull a light-weighted bone, which helps in resonance of the voice. Resonance means clearance of the voice. It acts as air conditioning chambers for the inspired air. To air conditioner, I mean to purify the air which is entering in a body. Third, it improves the quality of the voice. So there are three functions we learn regarding this. That is, first is helps in resonance of the voice. Second is clearing the air which is inspired, and third is the improved quality of the voice. Now, what is the example of the pneumatic bones? As you can see, there is a maxilla bone. Maxilla is the bone of the head region. Sphenoid is also, which we learned regarding the previous irregular bone. Then this is the ethmoid bone. Understood? Pneumatic bones are the bones which contains air spaces between them, which is mostly found in the head region. Why? Because to make it light in weight. Sixth is the sysmoid bone. Sysmoid bone. Sysmoid bones are the bony structures which are embedded inside the tendon or a joint capsule. Tendon, I mean, it is connecting to the first it is attached to the bones, second attached to the muscle. So it is present within the tendon or the joint capsule. There are many such examples when we consider the arm region or the forearm region. It lacks periosteum. The periosteum is the outer covering of the bone, so it doesn't have that, and it ossifies after birth. Maturation takes place after the birth. Surface of contact covered with hyaline cartilage. This is a very important point, that the surface is mostly covered with hyaline cartilage and lubricated with the synovial membrane. We learned regarding the joint that day in the previous video. So there I told regarding the synovial membrane. Remember? Yeah. The surface of contact is mostly from hyaline cartilage, and second, lubrication is done with the synovial membrane. What does it lack? It lacks, first we learned regarding it lacks periosteum. Second, lack medullary cavity, Haversian system or the periosteum. Yeah? This we learned in the second point. What is the example? As we all know the patella. This is a pisiform bone which is present in the carpal, which is one of the carpal bone, which we will learn in some of the video. Let's focus on the sesmoid bones. What is sesmoid bones? Sesmoid bones are the bones which are found embedded inside the tendon or a joint capsule. It is present beneath the either tendon, where the tendon is attaching the muscles and the bones, either present beneath or regarding to that, or a joint capsule. It lacks medullary cavities, periosteum, and the Haversian system. Haversian system usually found in the bones. Surface of contact is usually covered with the hyaline cartilage, and lubrication is done by the synovial membrane. What is the example? Example is patella and pisiform, etc. What is the function? Here topics come, very important topic. What are the functions of this bone? First is to resist the pressure, to take up all the pressure what is given on this bones, to minimize the friction, to alter the direction of the pull of the muscles, to maintain the local circulation, protecting the vessels and the nerves. These are the very important functions of sysmoid bones. To resist the pressure, to minimize the friction, to alter means to modify the direction of pull of muscles, or to maintain the local circulation, protecting the vessels and the nerves. As you can see in this diagram, this is the tendon, and the bones which is present beneath the tendons are called as the sysmoid bones. The last one is the accessory bones. What are these accessory bones? These bones are rarely present in individuals, usually occur as ununited epiphyses. What are the epiphyses? Epiphyses are the ends of the bones which is developed from the extra center of ossification. Ossification means maturation of the bone. What are the examples of this? As you can see in this first diagram, you can see some sutures over this. Remember, this is a suture. So this type of sutures are more rarely present. Sutural bones of skulls. Cervical ribs As you can see the ribs over here, but in the normal individual we lack the ribs, cervical ribs. So they generally present in some individual. These bones are also present. This is the lumbar ribs, cervical ribs. I don't have the diagram. This is the lumbar ribs. As you can see, this is lumbar region, right? Yeah. So what is the example of all this? Accessory bones are rarely present in the body. Usually occurs ununited epiphysis, means the ends of the bone develop from the extra center of ossification, means more maturation take place. Example, what is the example? Sutural bones of skulls, then the cervical ribs, lumbar ribs, etc. Common in which region it is common? It is common in the hydrocephalic skulls. Hydro means the water, cephalic means the region in the bone, in the head region. So this is the last slide, so I'll stop here. I hope you understood this topic. It's a very easy topic. Today what we learned regarding the classification of bone based on 7 types, that is long bones, short bones, flat bones, irregular bones, pneumatic bones, sysmoid bones, accessory bones. Thank you. Have a nice day. I hope you like this video.